The warm afternoon sun streamed through the windows of Grandma's living room as our extended family gathered for her 85th birthday celebration. I sat quietly in the corner armchair, still wearing my scrubs from the morning shift at the community clinic, too tired to drive home and change before the party. The conversation buzzed around me as relatives shared updates about their careers and accomplishments. "So Amanda," my cousin Bradley announced from his position by the fireplace, "still working at that little clinic downtown?" His voice carried that familiar tone of condescension I'd grown accustomed to at family gatherings. I looked up from my plate of birthday cake. "Yes, the Riverside Community Health Center." "Community Health Center," he repeated with a smirk, adjusting his expensive watch. "That's a fancy name for a free clinic, isn't it?" My Aunt Helen, Bradley's mother, joined the conversation from across the room. Bradley just made partner at his dermatology practice. Youngest partner they've ever had. "Congratulations," I said genuinely. Bradley puffed up with pride. "Thank you. It's been a lot of hard work, but real medicine requires real dedication. Speaking of which, Amanda, when are you going to stop playing around with clinic work and get into actual medicine?" "I practice medicine," I said quietly. "Come on," Bradley laughed and several relatives turned to listen. "Clinic work isn't real medicine. It's just band-aids and basic checkups. You're basically a glorified nurse practitioner treating people who can't afford to see real doctors." Cousin Sarah nodded in agreement. "Bradley's right, Amanda. The clinic work is fine for getting experience, but shouldn't you be thinking about specializing? Maybe family practice or internal medicine." "I did my residency in emergency medicine," I replied. Bradley waved dismissively. "Emergency medicine at some community hospital, sure. But what about fellowship training? Board certifications? Research publications? The things that separate real physicians from people who just happen to have medical degrees." Uncle Frank leaned forward in his recliner. "Amanda, your cousin has a point. Bradley's published 3 papers in dermatology journals this year. He's presenting at national conferences, building a real reputation in medicine." "That's impressive," I said. "The problem with clinic medicine," Bradley continued, clearly enjoying his audience, "is that it's not intellectually challenging. You see the same basic problems over and over. Colds, minor injuries, routine physicals. Any physician assistant could do that work." Aunt Helen nodded enthusiastically. "Bradley sees complex skin cancers, performs advanced surgical procedures. He's saving lives and advancing medical knowledge. Whereas clinic work," Bradley added with a condescending smile, "is just putting band-aids on society's problems. Important for the community, sure, but it's not real medicine in the way that specialists practice it." My phone buzzed against my purse. I glanced at the screen. "Riverside Medical Complex, emergency. See." Bradley pointed at my phone. "Always on call for the clinic. No boundaries between work and personal life. That's because clinic medicine isn't really a career, it's just a job." I silenced the phone and returned to my cake. "Bradley," Sarah chimed in, "didn't you say Amanda could probably make more money working for your practice? Maybe she could do the basic dermatology screenings while you handle the complex cases." "Absolutely," Bradley nodded. "Amanda, I've been thinking about hiring a physician to handle routine skin checks, basic procedures. It would be perfect for someone with your skill set. You could learn real medicine from someone who actually specializes." "That's thoughtful of you," I replied. My phone buzzed again. Same caller. "Amanda, Grandma called from her chair by the window. Answer your phone, dear. It might be important." Bradley rolled his eyes. "Grandma, it's probably just someone with a scraped knee who can't wait until Monday morning." I looked at the caller ID again and realized I should take it. "Excuse me," I said, standing. "I'll just be a moment." "Of course," Bradley said to the room. Clinic doctors never get to turn off their phones. No respect for personal time. I stepped onto Grandma's front porch and answered. "Dr. Thompson speaking." "Dr. Thompson, this is Janet from the ED. I'm sorry to bother you during your time off, but we have a situation that requires your immediate attention." "What's the nature of the emergency?" "Multiple trauma from a motorcycle accident on Route 95. The patient is conscious but presenting with possible internal injuries and definite compound fractures. He's asking specifically for you." I glanced back through the window at Bradley, who was regaling the family with stories about his latest cosmetic surgery procedures. What's the patient's name? Bradley Morrison. He says he's your cousin. Dr. Thompson, he's pretty shaken up and keeps asking when the real doctor will be here to treat him. My blood ran cold. Is he stable? Vitals are stable, but he's got obvious fractures in his left arm and possible internal bleeding. We need to get him to CT scan immediately. I'll be there in 15 minutes. Prep trauma bay 3 and alert surgery that we might need or time. Should I tell him you're coming? Just tell him his doctor is on the way. I hung up and walked back into the living room where Bradley was explaining the financial benefits of cosmetic dermatology to a captivated audience. Bradley, I said quietly, I need to speak with you. Can it wait, Amanda? I'm in the middle of explaining why aesthetic medicine is the future of dermatology. It's urgent. He sighed dramatically. Family, this is what I was talking about. Clinic doctors never learn to separate urgent from truly emergency. He turned to me. What's the medical crisis this time? You've been in an accident. The room fell silent. Bradley's face went white. What are you talking about? You were in a motorcycle accident on Route 95. You're currently in the trauma unit at Riverside Medical Complex. Everyone stared at me in confusion. That's impossible, Bradley stammered. I'm right here. I looked around the room at the confused faces. I'm sorry, I think there's been a mistake. Let me call back. I stepped back onto the porch and called the hospital. Janet, this is Dr. Thompson. Can you verify the patient's identity? Bradley Morrison, age 29, dark hair. Yes, and he keeps saying he's a dermatologist. He's conscious and alert but pretty banged up. I looked back through the window. Bradley was indeed at the party, uninjured. Janet, I think there might be two Bradley Morrisons. Can you check his ID again? Oh wait, Dr. Thompson. I'm looking at his license now. It says Bradley Morrison, but the address is different from what I initially saw. And looking at him again. This isn't your cousin, is it? Probably not. But if he's asking for me specifically. He keeps saying he knows Dr. Thompson from medical school. Says you'll remember him. Suddenly it clicked. Bradley Morrison from medical school. Not my cousin, but a classmate who had always been competitive and dismissive of anyone who didn't pursue prestigious specialties. I remember him now. I'll be right there. I returned to the living room where my cousin Bradley was still looking concerned. False alarm, I said. Different Bradley Morrison. Oh, thank God, he said, visibly relieved. You scared me there for a minute. I do have to go to the hospital though. There's been a serious accident. Of course there has, Bradley said, his condescension returning immediately. Amanda, you really need to learn to delegate these things to residents or physician assistants. I grabbed my purse and started toward the door. Amanda, Aunt Helen called, drive safely, dear. I will. As I reached my car, I heard Bradley telling the family, this is exactly what I mean about clinic medicine. No boundaries, no hierarchy. In real medical practice, attendings don't get called in for every emergency. The drive to Riverside Medical Complex took 12 minutes. When I arrived, the emergency department was buzzing with activity. Janet met me at the entrance. Dr. Thompson, he's in trauma bay 3. Conscious and stable, but definitely needs your expertise. We walked quickly through the department toward the trauma bays. I could see medical students and residents moving efficiently between patients, the controlled chaos I knew so well. Janet, before we go in, what exactly has the patient been told about his injuries? Dr. Martinez assessed him initially. Compound fracture of the left radius and ulna, possible concussion, and we're waiting on CT results for internal injuries. And he's been asking for me specifically? He keeps saying he went to medical school with Dr. Thompson and that you'll know how to handle his case properly. I paused outside trauma bay 3. What exactly has he said about me? Janet looked uncomfortable. Well, he's been somewhat demanding. He keeps asking when the real emergency physician will arrive. He seems to think the residents and PAs aren't qualified to treat him. I see. Dr. Thompson, he also mentioned something about you working at a small community clinic, and seemed surprised when I told him this was where you practice. I took a deep breath and pushed open the curtain to trauma bay 3. Bradley Morrison, my medical school classmate, lay on the gurney looking considerably less arrogant than he had 8 years ago. His left arm was clearly fractured and he had several lacerations on his face. When he saw me, his eyes widened with recognition. Amanda. Thank God you're here. These people keep telling me this is where you work, but that can't be right. I approached his bedside and began examining his injuries. Hello, Bradley. I heard you were asking for me. Of course I was. Amanda, you need to get me transferred to a real trauma center. This place is. He looked around dismissively. Well, it's not exactly Mass General, is it? I continued my examination, checking his pupils, palpating his abdomen, assessing his fractured arm. Bradley, you're at Riverside Medical Complex. We're a Level 1 trauma center. Level 1. His voice cracked slightly. But I thought you worked at some community clinic. I do. The community clinic is part of our medical complex. I reviewed his charts and test results. Your CT scan shows no internal bleeding, which is good news. But your arm fractures are going to require surgical repair. Surgical repair? Amanda, I need a real orthopedic surgeon. Someone board certified with fellowship training. I looked at him calmly. Bradley, I am board certified in emergency medicine. Dr. Peterson, our orthopedic surgeon, is board certified with fellowship training in trauma surgery. But Amanda, you work at a community clinic. This can't be where you actually practice real medicine. Dr. Martinez, the trauma surgeon, appeared at the bedside. Dr. Thompson, the oar is ready for Mr. Morrison's fracture repair. Dr. Peterson is scrubbed in and waiting. Bradley looked between us in confusion. Dr. Thompson? Amanda, why is he calling you Dr. Thompson? Because that's my name, Bradley. Dr. Amanda Thompson. But you're the community clinic doctor. Dr. Martinez looked puzzled. Dr. Thompson is our chief of emergency medicine. She's also the medical director of our entire trauma program. Bradley's mouth fell open. Chief of emergency medicine? Dr. Thompson, Dr. Martinez continued, the patient's fractures are complex. Dr. Peterson wants your input on the surgical approach. Tell Dr. Peterson we'll need to plate both the radius and ulna. The fracture pattern suggests we'll need bone grafting for the ulnar defect. Understood. As Dr. Martinez left, Bradley stared at me in shock. Amanda, what's happening? This is a joke, right? I pulled up a chair beside his bed. Bradley, Riverside Medical Complex is a 400-bed hospital with Level 1 trauma designation. We handle the most critical cases in the region. But the community clinic is our outreach program. We provide free and low-cost healthcare to underserved populations. It's part of our mission as a non-profit medical center. You're telling me this is a real hospital? With real doctors? Bradley, I'm going to explain your injuries and treatment plan. You have compound fractures of both bones in your left forearm. These require immediate surgical repair to prevent complications. But I thought, in medical school you talked about working with underserved populations. And I do. Along with running a trauma center that treated over 15,000 critical patients last year. Bradley was quiet for a moment. Amanda, how many doctors work here? We have 180 physicians on staff, including 25 emergency medicine physicians. And you're the chief? I've been chief of emergency medicine for 4 years. But in medical school you were always talking about community medicine, primary care. Emergency medicine is community medicine, Bradley. We treat everyone who comes through our doors regardless of insurance or ability to pay. A nurse approached the bedside. Dr. Thompson, or 3 is ready for Mr. Morrison. I stood up. Bradley, Dr. Peterson will take excellent care of your arm. The surgery should take about 2 hours. Amanda, wait. I think I owe you an apology. For what? For assuming that community medicine wasn't real medicine. For thinking that working with underserved populations somehow meant you weren't a real doctor. I smiled. Bradley, you're about to have surgery performed by some of the best trauma specialists in the state. Judge us by our results, not by your preconceptions. Will you be here when I wake up? I'll check on you in recovery. As the surgical team wheeled Bradley toward the OR, I returned to the emergency department where the usual Saturday evening chaos was in full swing. Chest pains, car accidents, industrial injuries, the full spectrum of human medical crises. Dr. Martinez found me reviewing charts at the nurse's station. Dr. Thompson, interesting case. The patient seemed surprised by our level of care. He had some misconceptions about community medicine. Well, Dr. Peterson was impressed with your surgical recommendations. Perfect assessment of the fracture pattern. Thank you. Dr. Thompson, the medical students are asking if you'll do the trauma lecture next week. They love your teaching style. Of course. Schedule it for Wednesday afternoon. My phone buzzed with a text from my cousin Bradley. Hope everything went well at the hospital. Still think you should consider real medicine. Winking face. I smiled and put my phone away. 3 hours later I checked on Bradley Morrison in recovery. He was awake and alert, his arm properly repaired and casted. How are you feeling? I asked. Better. Amanda, I wanted to thank you. And to apologize again. No need. Yes, there is. In medical school, I always thought I was better than classmates who chose primary care or community medicine. I thought those were lesser specialties for people who couldn't handle real medicine. I checked his post-operative orders. And now I realize that the doctor who just saved my arm practices at a community clinic. That the trauma center that probably saved my life focuses on serving everyone, not just people with good insurance. That's the point, Bradley. Good medicine is good medicine regardless of the setting. I have a dermatology practice in Boston now. High-end cosmetic work, cash-only patients. That's important work too. Is it though? I mean, compared to what you do here. I sat down beside his bed. Bradley, there's room in medicine for all kinds of practice. The patient who needs skin cancer removed deserves excellent care just as much as the trauma patient. But you're saving lives every day. And you're improving quality of life, treating diseases, helping people feel confident about their appearance. It all matters. He was quiet for a moment. Amanda, could I visit sometime? See how you run this place. Of course. We always welcome visiting physicians. And maybe I could volunteer occasionally? Use my dermatology training to help patients who can't afford specialists. I smiled. We'd love to have you. As I left his room, I thought about my cousin Bradley back at the party, probably still explaining to the family why clinic work wasn't real medicine. Tomorrow I'd return to the community health center for my regular shift, seeing patients who needed care regardless of their ability to pay. Just another day at the office.